Thanks, Chris. And now we're going to have a talk with a specialist by the name of, as we have it, Dr. Chris. And we are going to be talking about preventing HIV/AIDS. So, what is this prevention? What is this preventative called?
Yeah, so this preventative is called pre-exposure prophylaxis, also known as PrEP.
All right. And how does this PrEP work in a scientific regard, Dr. Chris?
Yeah, so PrEP basically will surround your T cells, because your T cells is what HIV likes to attack, right? So it'll surround these cells and act as a bodyguard for when HIV does come in contact, and prevents HIV from replicated and damaging your T cells.
Yes, very interesting, Dr. Chris. So what are different types of PrEP? How does this work?
Yeah, so there are a few different kinds. So there are two oral medications you can take. So there is Descovy and Truvada. And then we also have our injections, which you can take twice a month. Oh, once every 2 months, because it's long lasting. And then then you have vaginal rings, and those are not widely spread, but we are currently working on getting that into the U.S.
And Dr. Chris, what are the differences between these two oral medications?
Right, so they are both pretty similar, but Truvada, they can both be used as a daily preventative, but Truvada specifically can be used as a PrEP 2-in-1 or PrEP on demand. So that means that you can take it twice when you have sex. So you will take it 24 hours before, and then you'll take it within 48 hours after. And then Descovy is you can't do that with, as we don't have enough information on how it would work as to using it that way. But we also have the difference that Descovy cannot be used for people who are at risk with HIV for vaginal sex, or if you're at risk because of injection drug use.
All right.
But do not use this if you do in fact have HIV or AIDS, as it is not a treatment option. If you do have that, then I suggest going to your doctor, get a diagnosis, and discuss a treatment plan that would work best.
Yes, indeed. Always go to your doctor.
And if you are having issues with one of the medications, such as an allergic reaction or
Yeah, I was going to ask about side effects too.
side effects, then you should talk to your doctor once more and discuss changing that medication.
Yes, of course. So since we segued into that, are there any side effects or any disclaimers that we should know about these PrEP?
So Truvada is not recommended for people who have osteoporosis, as it can decrease bone density, but it is not the same for Descovy. But there are some. There's not a whole lot.
That's good.
There's mild reactions you can have, such as nausea, rash, fever, etc. But you may also experience some liver or kidney issues. And if you are feeling some type of way, then once again, talk to your doctor.
Talk to your doctor.
Yeah.
Always talk to your doctor. Right on you, Dr. Chris. Does PrEP help prevent anything else?
No, it does not. It only prevents HIV. So if you're taking it and thinking it's going to protect you from STIs in pregnancy, it is not. Please continue to use contraceptives such as condoms, and regularly get tested for STIs.
Of course, that's very important, Dr. Chris. Well, I don't got any more questions. Thank you so much for coming on.
Yeah.
This is very important to spread awareness about preventatives, as it just,
Of course.
Yes.
Yeah. Nice to meet you.
Nice to meet you. Back to you, Chris.